There's many challenges facing us today in healthcare, and part of it is that there's this disparity in or disconnect between the payer and the client or patient. When we deal with an insurance system, insurance really has its own interest in mind. That's why at Impact Health we focus on a cash practice. Not because we want to make it more financially difficult for people, but primarily because I find it's much more effective if there's no separation between the patient themselves and who's paying for it. What's happened in physical therapy in many areas of medicine is that we end up treating a third party, in many cases Blue Cross or Medicare, and they have a different requirement or interest in someone's overall health. In many cases it's how do they expend the least amount of money because then they get the most profit. However, with the individual, their health should be their primary focus, and obviously having value, which is effective care done as efficiently and cost effectively as possible, should be in everyone's best interest. At Impact, the reason I focused on cash practice is because for me that makes it very simple. I can then put all of my attention into the patient, do the things that are necessary, and the things that are not necessary, or particularly with meeting requirements by Medicare or Blue Cross where they limit what you can do with a client or a patient. It's imperative that the client understand the value in their overall care. And at Impact, we spend a significant amount of time in the initial exam assessing many qualities of the patient, their overall understanding of their own health, what their particular problems are as part of their overall history, and then we go through a very extensive physical exam, including functional testing, postural assessments, their overall girth measurements. We even do a cardiovascular screening called a DPA, which is a digital pulse assessment. By doing this, we get a more complete picture. The traditional physical exam, we do basically a full body screen, so we look at the person from head to toe. We look at screening out areas where there is particular concerns or areas of injury, pain, that type of thing, and we highlight those areas, and then we'll go into those areas in a more extensive evaluation once we're done with the entire screening. This gives us a complete picture of the client and is really the starting point for us in the physical therapy program. Once we have that picture, we sit down, we go through all of that information and make an assessment of what we think are the primary problems that the person needs to address, and then we sit down with them and go over the exam, go over the findings, tell them these are the things that I think you need to be focused on. This is how we can help you. These are other resources that you have that available that may be able to assist or maybe a better place for you to get care. If somebody needs acupuncture or other nutritional information, or they need a more extensive medical evaluation, say from a cardiologist, then we make those recommendations as well. And we don't try to be all things to all people. We have our particular skill set, which is particularly dealing with the neuromusculoskeletal system in a physical format. We do body work primarily, and in our clinic particularly we do integrated body work. So just the first part of telling you a little bit more about our practice and how we do things here at Impact.